Hello and welcome. I'm Dr. Vyas, and in this video we are continuing our discussion on inflammation. I'm hoping you watched my video from last time where we discussed the different kinds of inflammation and what they do for the body and to the body. So we are going to be continuing about chronic inflammation and how it is related to your heart or your heart health. Now, when it comes to heart health, people straight away think about cholesterol. Right? Increased cholesterol is the major risk factor for any kind of heart disease or heart attacks and all that. Now, I'm going to tell you that it is not cholesterol. Cholesterol is actually a wonderful chemical for the body. It is not the bad guy that everyone thinks about, and we're always running to reduce our amount of cholesterol that we're consuming. Cholesterol is something that's actually naturally produced by our bodies. Every hormone that we produce in our bodies, from your sex hormones to your stress hormones, are all produced by a precursor, which is cholesterol. There's a lot of different, every cell in our body has cholesterol in it. So your liver makes about 75% of the cholesterol that we see floating around in our bodies. 25% of that is from our diets. Now, of that 75%, it's about 3,000 milligrams of cholesterol floating around in our bodies in a day. So it's not cholesterol. Cholesterol is a good thing. The way I said, there's different reasons why that cholesterol will cause those plaquing of the arteries that we hear about when we come to heart disease. So what causes that plaquing? The plaquing is the one that, when you have the formation of plaque in the arteries that restricts blood flow, causing heart attacks or strokes. Well, the main reason for that is inflammation. Yes, you heard it right. It's inflammation. Now, what happens is our diet and lifestyles. Those are the biggest major contributors to any of these things. We're eating a lot of processed sugars. We're eating a lot of carbs and things that are more inflammatory to our bodies. Our arteries have a muscle, or they are muscle because they have to contract and relax. Now, you have a layer in there called the endothelium, which actually gets injured from all this stuff that you're doing. There's always a little bit of almost like a scratching that happens on the endothelial lining of the arteries. And when that happens, the way I said, that's considered to be, an injury to the artery, and your body's natural response is it creates inflammation to help heal that injury. Now, the first thing that happens is the way I said, when you have any kind of injury to that, you have an inflammatory response in there. And when your body creates that inflammation, then you end up with cholesterol. There's the LDL, HDL that we talk about. I'll talk about that in just a second. The good cholesterol and bad cholesterol. Well, LDL is known to come and form those plaques. That is a repair response by the body. Repair for the inflammation that's occurring in there. So the LDL that comes is actually helping correct or helping repair some of that inflammation that's occurring. Now, as yes, LDL is kind of a bad thing in some ways because the more of these processed foods, the trans fats that we eat, create higher level of LDL in our bodies. It is a lipoprotein. So what that means is it's LDL stands for low density lipoprotein. It's a protein molecule that is actually encompassing the cholesterol and taking it around the body. Now, LDL considered the bad guy because LDL brings the cholesterol from your liver, where everything's made and also eliminated from the liver into the body. And then HDL, the good guy that we call the healthy cholesterol, HDL takes cholesterol from your bloodstream into the liver to be broken down and be used up. So the LDL, the way I said, from trans fats, the fatty foods, the partially hydrogenated oils and stuff that we're eating now, increases that LDL level. And so if you already have a little bit of injury and the inflammatory response in there, you end up with more of that LDL sticking to those things, causing a larger plaque. So what comes up with when we talk about this cholesterol? Cholesterol is not bad. Now, you've seen there's a lot of research out there. Don't just take my word for it. And I'm not encouraging you to go out and eat heavy cholesterol diets or anything like that. But cholesterol is not bad. It is the response that your body creates to the inflammation. That's what causes the plaquing, and that's what leads to heart disease. So how can we change that? Well, simple stuff again. It's your diet and lifestyle changes. Modify your lifestyle, which means exercise a little more, because we know exercise not only helps your heart and your muscles, but exercise has been shown by research to actually help reduce inflammation in the body. And then the big one is your diet. If you reduce a lot of the inflammatory foods that we're putting in our bodies, what happens? The inflammation goes down, and so you will not have a lot of that plaquing or any of those things happening, or damage to the arteries occurring. So reading some of these articles, I just read something that was very interesting. They say that about 50% of the people that suffered a heart attack had normal cholesterol levels. There you have it, right? So it's not just the cholesterol that's causing heart problems. It is what the body is doing with the cholesterol that's causing that. So we want to make sure you don't give that body the plaquing or anything to occur. So reduce the level of inflammation. Again, when he talks about lifestyle stuff, there's things like smoking. There's high sugar diets. You're talking about lack of exercise and all these. These are factors that contribute to inflammation in the body. If you control those factors, if you help control some of that, you can end up with, I'm not saying you'll solve your heart disease, but that means you will not need a lot of the statin drugs that they're talking about. Now, there is also a very important or interesting test that shows your risk for heart disease better than just your cholesterol levels. Because we all know when you go get blood work done, you have your cholesterol levels, your HDL, LDL, and then triglycerides levels checked. Well, the big thing that they don't check is something called C-reactive protein, or CRP for short. This is a protein that's formed by your liver as a response to inflammation. Now, they have shown that this is a much better indicator, or a much earlier indicator of heart disease than just your cholesterol levels. So go get it's called high sensitivity C-reactive protein. Have those numbers checked. I know a lot of doctors are doing it now, and if they're not, and you have a high risk for heart disease or something, I would recommend you ask your doctor to test your HSCRP, which is high sensitivity C-reactive protein. Get that checked. It's a much better indicator. We do that test in our office as well. So if you have any of these risk factors and you want to get checked, give us a call and we'll get that test ordered for you. So hope this information has helped you, and we're going to continue our journey with this multi-part series where I'll talk about what can cause other diseases that we're all familiar with and what is the root cause of them. So hope this has helped, and if it has helped you, please share this information with others, because I know somebody or a lot of people can benefit from this information. All right, and as always, I'll catch you in the next video. Thank you.